When it comes to the umbilical cord blood stem cells, these cells are derived from human umbilical cords. The cells are undifferentiated, so there's no matching like blood typing or anything like that. No potential for allergic reactions. It's simple, fast, and safe through intra-articular injections or IV infusions. It's customizable for the individual. Potent, robust, and consistent cells, and it's based on accepted medical practices. So this is one, bear in mind, stem cell therapy, although we're hearing more about it than ever before, it's not a new science. They've been using stem cell therapy for decades, and even umbilical cord stem cell therapy, they've been using it for decades in the field of oncology for certain types of blood cancer, when they'll give chemotherapy that totally wipes out the blood counts, and then they'll use stem cells to reconstitute those blood counts after the fact. Anybody familiar with that? Anybody had friends or family that experienced? Yeah, it's not a new thing in that context. What's new about using umbilical cords for joint repair is just simply that they didn't use it for that until relatively recently. So you should be asking yourself, well, where do they come from? The great thing is that they're umbilical cord tissue from healthy birth babies and healthy mothers, and I will say the labs that we deal with, they have only collection sites in the United States, so they're all from American moms. And this is the safest and least invasive method of extraction. You know, essentially, and some of you may have experienced this as a parent or a grandparent, where a mom's going to have a baby, and maybe 6 weeks or a month before they're ready to have that baby, they will be asked, did you want to bank your umbilical cord? Anybody familiar with that idea? Yes. Okay. And so there's a cost associated with banking your umbilical cord. So not everybody makes that choice, but what the second alternative is whether they want to donate their umbilical cord. So what it has resulted in is a pretty good, stable supply of umbilical cord tissue to be able to draw upon for a good, consistent supply of stem cells. So the advantages of umbilical cord blood stem cells, they're immune system privileged, so anyone can be treated. They're potent in terms of anti-inflammatory activity. They have a strong immune modulating capacity. They have an optimum ability to stimulate regeneration, and the mode can be either directly into a joint or by way of an IV infusion. And we've done both of these. The IV infusion can be for somebody with a chronic disease like ALS, MS, or fibromyalgia with aches and pains all over the place, or myofascial pain syndrome. Those are examples where an IV infusion might be a more effective fit. Umbilical cord blood stem cells, safe, effective, and affordable. Your safety is really our top priority. We utilize things in our clinic, procedures that are based on my experience as an oncology nurse, my nurse practitioner's experience in general practice, and a variety of other styles of practice. Safety is our top priority.